loans. We've had comments from hospital networks or mini systems, if you will. And we also know that one of the evolving models is when hospitals become part of a larger system, and that's another pathway to sustainability in a small and challenged rural environment. So, closing out the presentations this afternoon, we have Darren Pearce, who's with Peach County Hospital, which is part of the Navicient system, growing system in central Georgia. It all started off with what used to be Macon Medical. When I was in practice in Cordele, it had already changed and moved on to the Medical Center of Central Georgia, but everybody in Cordele called it Macon Medical. And then it was the Medical Center of Central Georgia, and now it's Navicient, and it's expanding its footprint, and it's reaching out into some of these smaller communities to provide support and sustainability. And guess what? Some of this has to do with some of what we heard earlier about stuff from small communities being able to stay in smaller communities because of the support. But parts of it has to do with this notion of upstream support and returning people back to your community after they've had the services that only a bigger medical center can provide. So with that, Dan, I'll turn it over to you. Thank you.
Thank you very much. So first of all, I know there's no I in team, but apparently there is an A, and I had to borrow it from the top line of this slide here. So it's not that I'm totally incapable of spelling and using grammar, but that does happen. So first of all, a little bit about me. Way back in the day, I decided that I'm going to go to school and I was going to be an engineer. And engineering school really wasn't my cup of tea, but maybe going to class was my bigger issue. So after about a year and a half with a GPA that was way south of the border, I decided that maybe I should do something different. And I was a little bit impulsive. I was driving home from my chemistry test. I made a 55 on, and I said, well, I'm not very focused. And I saw Armed Forces recruiting. 7 days later, I was in San Diego, California, in boot camp. And a year later, I was in submarines, and that's what I did for the next 3 years, is ride around in submarines. The thing about submarines is that it's a very closed environment. There's 150 guys on board, and 150 of them, about 100 of them, probably in the age range of 18 to 23. So you can imagine the maturity level is very high. So you have to find creative ways to get along with each other and, learn to work together. Now on submarines, it's because two things that are really bad on submarines are leaks and fire. And if that happens, you better be able to respond very quickly. You better be a team, and everybody better know exactly where they're going and what they want to do. And that means all learning to live together, work together, be friends together, grow together, talk about everybody together, talk about your wives, your girlfriend, whatever. Okay. So, keeping it simple. What I've learned over the years, I'm a nurse by training, and what I've learned is I want to know what's going on if I'm a nurse. Take care of this patient, use this piece of equipment. Why? I just don't know why we're going to this piece of equipment. So if you can't give me that answer, you're going to confuse me. I'm going to be concerned. I'm not thinking you understand what my issues are. So I feel like you need to make sure that you talk to your staff, you talk to the people around you, you get buy-in, you get input from them. So I like to keep it simple, because I believe that a happy staff will make a happy patient, which will make for a happy bottom line. This has been true for quite some time for me. I've taken it everywhere I've been. When I came up to Navicient, which back at the time, Medical Center of Central Georgia, but before that, I went to work at the rehab hospital, which was under Health South at the time. I went in there, I said, what can I do that's going to make a difference? So, I want to make sure that staff is happy, but the biggest thing was, it was like, you walk into a room and patients can be like, they look for you for compassion. They look for you to be happy. They'd be looking for the staff members to make them pat them on the head and say, I want you to feel better. Well, what would happen was, invariably, staff would not go that direction. So they would kind of, look for, reasons why they were not doing a good job. We're short-staffed today. We don't know where this piece of equipment is. Your parent, I don't know where your parents are. I don't know where your mom and dad is. Visiting hours in at 9 o'clock. So these were our concerns. So I went to the rehab hospital. I took the job as executive director. Made a few changes. We had a lot of success. We saw patient satisfaction go through the roof. I saw staff satisfaction go through the roof. And Dr. Saunders, if you don't know her for Navicient Health, she says to you this. She'll go, So that's great, you did a great job there, very impressed, but can you do it again? So she said, well, you go down to the medical center of Peach County, and when you take over medical center of Peach County. I said, well, in my mind, no, I don't want to go there. That's where careers go to die. Okay? So I said, no, I'm not going down there. But to her, I said, sure, I'd be glad to help out any way I can. So off I went down to the medical center of Peach County. One of the things I noticed when I walked in the door, they have a fountain in the front. If you ever seen Peach County, it has a nice fountain. This was the new building. This building had been there 2 years when I got there. Before that, it was an old hospital, about 60 years old, in Fort Valley, had rats in it. They dug up the floors. They replaced piping because they'd had leaks. You know, the worst possible case. And they said, well, let's get together with Navicient, and what we'll do is we'll build a new hospital, and that's what they did. They built a new hospital out by I-75 environment. Okay? What I will tell you is, you can build it, and they will not come. The average daily census at the old hospital in Fort Valley was about 6 to 7 patients. The average daily census when they built the new hospital in Byron was 5 to 6 patients. So the EC was seeing about 12,000 patients in Fort Valley. They started seeing about 9,000 to 10,000 at the new hospital. So I walked in, all this is going on. I walk in, the first thing I see is this fountain on the front. What color are fountains usually? Blue with a little white bubbles and stuff. This fountain was green, including the cement. This is brand new fountain. This fountain's 2 years old. It's already green in color. There's algae growing on the top. Okay. I walk in, there's an overhead. I look up, there's more wasp nests up there than, I mean, if they all decided to swarm at one time, we'd all be there. And so I'm like, these people have lost faith in what they're trying to accomplish. They've taken what they did at the old hospital, trying to make next payroll, trying to keep the building up and running. They were taking all that, and they were trying to, and they just brought it with them to this new hospital. So the next thing I saw when I walked in was the ultraviolet light at the front door. It had the extension cord on it, going straight down the wall, tied to it with, I kid you not, thread ties to little hooks in the wall into a plug. This is a brand new hospital. So I'm kind of freaking out a little bit. I'm like, oh my gosh, what's going on here? So next thing I see is there's a guy, and he's in there, and he's tore out half the sheetrock in a brand new wall. And he's in there fixing a valve behind the wall. And I asked him, I said, why are you fixing this valve like this? He goes, well, we don't have a lot of money, and I want to save money as best I can. $7,000 later, we fixed that leak. You know, sometimes you just have to take that leap of faith and know that you're not capable of doing that job, and you've got to find your way. But the thing about it is, they were so used to living on the edge, trying to make the next payroll, trying to save money wherever they could. They still had that mental defeated attitude that there's no way we're going to be better than this. So it didn't matter how nice your hospital was. It didn't matter what you had going on there. They were losing doctors. There was infighting between Byron and Fort Valley. You know, why the hospital was there in the first place. And sitting right next door to this hospital is the interstate, and on the other side of that is Houston County, one of the fastest growing counties in the state of Florida. So how do I tap into those resources? That's the question. How do you tap into it? You know, Robin talked about some things she did to tap into resources there. We did the same kind of thing. We were trying to do this, we were trying to do that. But the key here is, to me, is that happy staff. Until the staff buys into what we're trying to accomplish, it does not matter what else we do. If they don't believe in your message, it goes nowhere. I will tell you, to get an engaged staff, it's going to take a lot of work on your part. But it's not as easy as send them out a memo every day. You can't do all the work for them. You can't go out there and spend one day a month, walk out there and say hello to everybody. It requires you to go out every single day, be engaged with your staff, ask them what they need, what can you do for them, listen to their concerns. I will tell them all the time that you got a question, I'll give you an answer. It may not be the answer you want, but I will give you an answer. And that's what they want. They want to know what you're going to do. Being engaged means showing them that you're willing to ask them to do anything that you would not be willing to do yourself. I walked in there, I was probably there 3 days, and I was walking by the EC. I'm a nurse by training, so don't get scared. They called the code blue. So I ran down there, I went in there, patient was laying there, somebody was doing chest compression. I said, do you need to leave? He said, yes. I started doing chest compressions. Now, the scary thing about it was nobody knew who I was. There was some guy in there with a tie doing chest compressions. That's all they ever talked about. But that went further in that hospital than anything else I could have done, because they were just like, wow, you're really engaged, you're talking the talk, walking the walk. And that's what we tried to do. So, over a period of time, I saw some engagement from the staff coming. We would try to have regular town hall meetings. But the next thing that was most important was you try to engage your staff, but if you don't have management that's working there with you, engaged in what you're saying, walking out at every meeting, arm in arm, singing Kumbaya, it's never going to work anyway, no matter what you do. So I went out and trying to find people that I know I could get engaged. So I don't care where you work. I don't care if you work in the lab. I don't care if you work in EVS. I don't care if you're the guy cutting grass in the back. If you're going to do work and you're not afraid to get your hands dirty and get out there and do something, I'm going to bring you along. Okay? First person I found was a laboratory manager. She, 3 months prior to me coming there, worked as a lab supervisor at the main hospital in Macon. She took this job as an opportunity because she thought, well, I can go down, being a supervisor here, I can't get out of it. I can go down there, be the lab manager. And everybody told her, why would you go to Peach? That's where careers go to die. Okay? Why would you go down there? She wanted an opportunity. She wanted to make a difference. I recognized that very quickly. I brought her along. I will tell you today, I'll tell you her name is Lorraine. Today, she moved from lab supervisor to lab manager to director of operations. And now she's the hospital administrator at Monroe County. So she did all this in 2 years and doing a very, very good job. Untapped resource, give people an opportunity to see what they can do. I had no problem going to her and saying, I want you to do this, this, or this, whatever it was. She'd go, I don't have any idea what that is. I don't care. You got to go out and figure it out. You got to look into it. You got to say, you got to dig into it and find out how to do it. I cannot do it for you. The previous administrator before me, the previous CEO at the hospital before I got there, wanted to do everything herself. There is no way you can do that. You cannot micromanage yourself in these hospitals. You cannot see the bigger picture if you do that. So, I encourage the staff to go out there and figure out how to do anything the way they want to do it. I don't care how they do it. I want them to make mistakes, lots of mistakes. I'll get into a meeting with you and I will tell you right now, if you're not making mistakes, you're not doing the job right. You need to be making lots of mistakes. That's the only way you're going to learn. You got to go forward. You cannot stand still. The biggest problem I see in smaller hospitals, rural hospitals today is we all want the hospital that our daddy had. Okay? Can I keep everything that we've always had? Can't do that. Things are changing. You heard it from Robin. She had to find out what she had to do to make a difference and change. We have to do the same thing, but we have to get everybody engaged in what we're trying to accomplish. Okay? And I can tell you that you can make all these changes like she did, but I guarantee the first thing she did was engage her staff and make them happy. And they were buying into what she was trying to do. Some people won't. Okay? There's 20% of the people you're going to lose right off the top. They were never engaged no matter what you did. 60% are like, well, whatever you want to do, we don't care. We're just here. We're trying to pick a paycheck. And then you got 20% more that are ready to do whatever you ask. They will walk off the face of the earth with you. They will go the whole way. Find those people, bring those people along. The other 60% will follow along with that. The other 20%, they'll be transitioning over time anyway. Don't focus all your management time on those people. They are not going to be there for you no matter what. Focus on that 20% and that 60%. That's the best thing we can do. So, we're looking for clear direction, strong relationships. I try to meet with the staff on a regular basis. I try to meet with all my management team on a daily basis. And if you're married like I am, I'm sure that my wife feels like I have 5 or 6 different girlfriends and boyfriends, for that matter. I'm on the phone all the time, 24/7. A lot of times it's not about stuff that all about work. Sometimes we're just building those relationships. We get along well, we talk about things, we're all on the same page. You want a shared sense of responsibility. Their success is my success. I don't take credit for their success. I try to promote them up. I want them to be successful. I want them to feel that what they're working for is going to be great for them, and it goes really well. We want defined objectives. You need to know where we're heading, where we're going. There can't be any confusion about that. You've got to allow them to speak their mind. They got to be able to tell you what their concerns are. They can come into my office and they can say anything they want. They can close that door and they can tell me I am the dumbest person on the planet. But when we walk out, we have a consensus. And whatever that is, we're walking out together and we're going with that, whatever that our consensus was. We want our measured success. We want diverse ideas and styles. I don't like people working for me that are just like me. Matter of fact, if you're just like me, that's the last person I want you to have. I know me. You don't want me. Okay? What you want is somebody can come in. I'm not real good at the day-to-day details. I don't want to know the deep, dark details. I want to know the broad strokes. And so I hire people that are very detail-oriented or have some other skill set that I'm looking for. Team dynamics. Individuals have different strengths, skills, personalities. We want to challenge them. We want everybody needs to get to know their self. Don't be afraid to talk about what your shortcomings are. Talk about your failures, where you learn, what you can do, and what you've done different. And so, clearly what we've been talking about is all the characteristics of high-performing teams, and managers' responsibilities and employees' responsibilities, which are pretty straightforward and clear, but they need to understand the boundaries of where we're going. They need to take their own ownership. They need to maintain communication, know when to seek help, and honor their commitments. They will do this if they see that you're consistent and fair. If you're out there walking that walk, talking that talk, you're consistent and fair, you will not tolerate the bad behavior. Don't bend over backwards for the people that are you're not going to make happy no matter what. And they will see that and they will flock to your banner. Biggest thing is trust. Trust them to do the right thing. I trust my staff, I trust the patients, the staff that works for me, that they have the best interest of the patients and the safety of the patients and the viability of the hospital. And if you trust them to do that, they will buy in. Once again, we'll start seeing improvement. So I'm going to show you some results of some of the what's been happening at Peach, and then some of the other hospitals I have as well as some partnerships we have with some other hospitals. Some of the stuff they're doing that I think is very positive and great for the communities. So this is the Medical Center of Peach County. Here's the green fountain in the front. My green there. It's my favorite picture is the twilight. It's all lit up. Looks pretty good. So this is their fall rates by quarter. They went up a little bit. They come down. They're starting to stabilize. This is what I'm most proud of with them. I think they are too. Is on their quality. We have a lot of central lines because we have a very robust swing bed program. And we do a lot of antibiotics. We've had 1,121 days since our last CLABSI, 503 days since our last CAUTI, and 419 days since our last CDO. So, the nursing staff has worked extremely hard. My chief nursing officer, Laura Gentry, I stole her from Allison Medical, and she has been one of the best things I ever did. So she's now the hospital administrator at Peach County. So. Patient experience. When I first got there, this one goes back to 2016. When I first got there, we were in the the teens on the percentile for patient satisfaction. We've got up to 75%. So we're very excited about that. I see that getting even better as we move forward over the next couple of years. I have just recently taken over Monroe County Hospital in the last year. Monroe County Hospital, very similar situation you saw earlier. They were losing about almost $3 million a year. When I walked in the door, they were 3 months away from closing. It was just a bad situation. They were desperate at the time. They had been fighting with Navicient for a couple of years about taking over management. Finally, they were like, let's take it over. Now, I will tell you that when I walked in, Lou was there when I got there. Am I telling the truth, Lou?
No.
I'm not telling the truth?
I was not employed.
Yes.
I was on the side of trying to help fix the problems.
Yes.
I didn't create the problems.
I didn't say you created the problems.
And you're being generous. There's other things that
Well, yes, I'm being generous. But I will tell you that when I walked in, they were like, whatever you want to do whatever you want to do. They didn't care what you do. However you fix it, just make it better. You want to keep a hospital. I told them stuff they didn't want to hear. There were going to be changes to the hospital. We're going to have to reduce the size of the hospital. We're going to have to find things where we can make money. Other than saying that, happy staff makes for happy patients, makes happy people, I also believe that you have to pick 3 to 5 things that you can do really, really well. At Peach County, we focused on the emergency room, we focused on the swing bed program and procedural volume. And I will tell you that we've going back to Peach, we've gone from 12,000 visits a year in the EC to 23,000 this year. Our average daily census runs about 23 right now. We have anywhere from 12 to 15 swing beds at any given time. Our procedural volume has quadrupled since we've been in there. So that's helped for a very robust bottom line of Peach. And you can say that we're very happy there. Monroe County, similar situation. We have to figure out what we can do well there. Since we've been there in the last year, we've seen emergency room business slowly but surely start to climb. Med-surg patient days climb. And then the financials, we've seen gross revenue come up, and we've seen some expense go down. We had a $717,000 difference from the previous year to this year. And of that, $344,000 of it was non-operating expense for this bond issue that we put through, that the county took total ownership for this hospital, and they wanted to be successful. And then Allen at Putnam, they're one of our partners in Navicient Health. And one of my favorite things they do is they do that drive-through flu shot campaign. I think that's just awesome. I think it's a real satisfier, isn't it, Allen? Everybody's very happy there in the community. And I really want to bring this everywhere. As you can see, people line up to get their flu shot. I bet that doesn't happen everywhere. And then our most recent acquisition, we took over Navicient Health Baldwin. We've been in there for all of 31 days. This hospital is a 140-bed hospital, and it has the same issues that all small communities have. The dwindling population, industry leaving, doctors can't get doctors on board. Just it's one thing after the other. But I'll tell you that we're going to do the same thing we did there. First thing we're trying to do is get the staff on board, and you got to engage your workforce. I believe that engaging your workforce, getting them on board, getting them to agree what the direction you're trying to go is going to make the difference to where you're trying to get with that bottom line. So if they don't believe in you, I will tell you this, the biggest thing I heard at Navicient Baldwin when I got there was this. Well, when I go out to the community, go to the store, I take my badge off, and I put it in my pocket. I don't want anybody to come up to me and ask me, how's the hospital doing? Tell me what's going on in the hospital. They just rather not talk about it. If I can get them to where they'll walk out there and go to the grocery store with their badge on, we have success. That's simple. All right. That's all I got. See, I'll get you out on time.
Any questions? Yeah, Darren.
You talked about that when you arrived, you can usually expect it's going to be 20% that leave, 60% that are there for the ride and they will follow leadership, and 20% that will grow with you. How do you identify that 20%?
Well, I like to say I'm a super genius, so I can just speak to people out. It's not the case at all. So I'll walk around. I'll make rounds in the hospital. I will talk to everybody. I will talk to doctors. I will talk to other nurses or other staff members. And then I will talk to people that work with them in the past, like because they have a relationship with Navicient, so I can talk to people who work with Navicient. So I can find people that people seem to like. And then I can pick out 5 or 6 people. And then what I'll do is I give them work, lots and lots of work. And if they'll do the work, they do it with a positive attitude. They go for it. Well, then you start identifying your people very quickly. I can't just go up there and say, I like the way you look. You are the one. It doesn't work that way for me. I have to just go out there and scrounge them up, work them to death. Cream rises to the top, almost every time.
So I have a question. Your model is different from some of the other models that we've heard today. Explain to us in the Navicient model with these newly developed relationships with big communities, what the governance relationship is with those communities and the previous existing community boards and how that works.
So it depends on where we are. So at Monroe County, it's a management contract. At Peach, we own that facility. Baldwin, we own that facility. And at Putnam, it's a management contract as well. So if we own the facility, when we go in, what we try to do is we will establish a new board. Essentially what we want to do is when we walk in the door is that we want to change the mindset. So it's, I hate to say it's a defeatist attitude, but it can be. You know, we're so used to losing, we're so used to scrambling, that we need people to come in that really had no idea how hospitals really work. And they're really confused by this whole, you know, how much money is being taken off the top. How come we're paying $8 for a Tylenol? You know, they need to understand those kinds of things. So really, they come in with brand new ideas. So when we go into these hospitals that we buy, we try to change the whole board. We don't change the model to where the governance structure is set up to where there'll be half the board will be composed of community members, the other half will be composed of Navicient board members. And so what we're trying to do is we're trying to get a marriage between the two. And that's what we usually do when we go in now. When we go into the communities that we manage, we keep the same boards that we've had. And, you know, we can work well with the boards that are in there. We can work, and sometimes we'll pull board members from the old board onto the new boards that we form. But it really works well if you bring in community members that know how the community needs and what community needs are. I'm going to tell you, I didn't talk about this much, but if you don't dive into the community at first, you will run into all kinds of problems. You have to dive in there. You have to talk to them, find out what their needs are, what their wants are, what they want to see. And then you have to explain to them what they can and cannot have. And I'll tell you this, I will tell them the same thing I told you earlier when I tell staff members. You can ask me any question. I will give you an answer, or I will find an answer. It just may not be the answer you want. But you know, healthcare is changing rapidly. So if you're not willing to balance a little bit, you don't run into problems. I don't know if I answered your question well, but
You evaded it just like a politician.
yeah, I'm going to get you.
It's that time of the year.